This is Newsmax TV. I'm Ashley Martella. Democrats are trying to advance their health care reform legislation. 3 bills are pending in the House and 2 in the Senate, all of them calling for various government controls where none was ever present before. Also, for the first time in history, individuals could be penalized and fined for not purchasing a product, in this case, health insurance. One of the most informed and articulate opponents of Obamacare joins us now. Former New York Lieutenant Governor Betsy McCaughey is a health policy expert with a Ph.D., a patient advocate, and a constitutional historian whose writings have appeared in the Wall Street Journal, Forbes magazine, the New York Times, and the New York Law Journal, among others. With her is Dr. Richard Amerling. He's one of the 16 highly regarded physicians who expressed their concerns about the health care reform at a symposium organized by Dr. McCaughey this week. She also plans to present their remarks to Congress. Doctors Amerling and McCaughey, nice to have you with us.
Thank you.
Dr. Amerling, what is it about the healthcare overhaul packages that scares you the most?
I think the most scary aspect is the loss of physician autonomy. Doctors are literally going to be prevented from treating patients to the best of their ability, to the best of their judgment, by what will become guidelines coming from central authority, central committees on what are so-called best practices. Now, of course, these guidelines have a tremendous amount of error built into them. They are one size fits all. Medicine, when practiced at its highest level, is a very individualized art form, and you cannot reduce it to a guideline or to a prepackaged check on the menu, check one of column A, one from column B. It doesn't work that way. But doctors are going to be under the gun to conform to these guidelines under penalty of being paid less. And this is the system of payment for performance, which is a way of cost control.
Do you fear that adequate medical care will have to be denied to the most vulnerable patients, particularly the elderly, if this becomes law?
I am virtually certain that that will occur. I'm very confident saying that based on the writings of Ezekiel Emanuel, who is very likely going to be one of the key people writing policy. I can also tell you that in my own area of kidney disease, there are already planned cuts in reimbursement for the care of kidney failure patients who are among the most vulnerable patients that exist.
Is there anything you like about the healthcare reform provisions?
I haven't seen anything to be happy about in the healthcare reform provisions. I know that the bills that have been put forward are extraordinarily complex. They are very difficult to get through. I have tremendous admiration for my friend and colleague who has had the intestinal fortitude to pick through these bills and get the details out. But there is absolutely no way that good, meaningful reform is going to come out of this Congress, because the Republicans who have some good ideas have been completely excluded from the process.
Including a couple who are physicians themselves. Dr. Amerling, let me ask you this. Do you feel you've been ignored? You and your fellow physicians have been ignored? Your concerns have been ignored by Congress?
I think we've been virtually completely ignored. There have been obviously meetings with the so-called leadership, i.e. the AMA, and the AMA has endorsed what's coming down without, I believe, full knowledge of what it's all about. I don't regard the AMA as speaking for myself, and I know that most of my colleagues feel the same way. They have long ago abandoned a role of true leadership of the medical profession, if they ever had one.
What is behind the AMA endorsement of Obamacare, do you think?
Well, what they were looking to do was to get rid of a particularly ridiculous payment system that has been in effect since, I believe, 2003. That would be the Sustainable Growth Rule, the SGR. Now, what this said was that doctors' fees would be cut if there was unsustainable growth in Medicare spending year to year. The problem is that whenever you cut doctors' fees, the volume goes up and spending goes up. So that rule would have created a downward spiral in reimbursement to physicians that would have led to mass resignation from Medicare on the part of practicing physicians. So knowing this, the Congress stopped these cuts from occurring each year. So in effect, the AMA traded away their endorsement for a promise to repeal SGR. The irony is that SGR was a moot point because it was never going to be actually enforced.
Dr. McCaughey, as a painstaking patient advocate, what impacted your thoughts the most about what you heard from this panel of doctors?
The legislation is going to force doctors to choose between their patients and avoiding government penalties. The stimulus legislation that was signed into law on February 17th of last year provides that doctors will be sent protocols from the government on what is cost-effective and appropriate care. They'll be delivered to doctors electronically on computers, and doctors who don't obey these protocols will be penalized financially, as Dr. Amerling pointed out. So that doctors will have to choose between what's good for their specific patient who may be older than what the protocol describes or may have complex other illnesses that make that protocol inappropriate. But then doctors will have to worry if they stray from that protocol that they're going to be punished financially. And in addition, these protocols are designed not simply to provide the best care for patients, that would be ideal, but instead to save money at the expense of patients. The most troubling aspect of this government control over doctors' decisions is the provisions regarding Medicare, which is eviscerated under the Baucus plan, one of the 5 bills currently making its way through Congress. The Baucus legislation literally undoes the protections that have been there in the law ever since 1965 to prohibit the federal government from interfering in the decisions that doctors make for elderly Medicare-eligible patients. Now, for the first time, the Secretary of Health and Human Services will have the power, very broad power, to define what kind of care elderly people should get, how much it should cost, and to penalize doctors who depart from that agenda.
All right, Dr. McCaughey, you've gone where few have ventured to. You've actually read everything made available, including the entire House bill.
That's right, House Bill 3200.
House Judiciary Chairman John Conyers, a lawyer himself, whines that the bill is too complicated for him to read without the help of 2 other lawyers.
Well, frankly, it is hard work. It's disappointing that members of Congress don't read it, but the answer is to provide short, I suggested 20-page bills to address one legislative issue at a time, 20 pages in clear, simple English. After all, the framers of the federal government created an entire national government in just 18 pages.
Over on the Senate side, the Finance Committee actually passed a bill that hadn't even been written yet. Isn't that correct? And what does that tell constituents about the attitude of their senators?
Well, they're really not paying attention to the best interests of their constituents. And my biggest concern is for the elderly, because all 5 versions of this legislation pay to cover the uninsured by removing approximately $500 billion in future Medicare funding. That's almost a 10% reduction in future Medicare funding at a time when 30% more people will be in Medicare as the baby boomers reach age 65. And that is going to mean fewer hip replacements, fewer knee replacements, fewer bypass surgeries, and simply less care for the elderly.
Doctors Betsy McCaughey and Richard Amerling, thanks so much for sharing your thoughts with us at Newsmax.
You're welcome.
And thank you for watching Newsmax TV.